Hello, everyone. I hope you all enjoyed a nice lunch. It certainly is a beautiful early summer, late spring setting. I want to thank you all very much for being here. It's obviously a very busy week for many of you being at the World Health Assembly. We're grateful for your time. My name is Jennifer Austin, and I'm the CEO of the International Alliance of Dermatology Patient Organizations, also called GlobalSkin. And I'm proud to be here with two co-host organizations today, the International League of Dermatological Societies, or the ILDS, and the International Alliance of Patient Organizations, IAPO. So we are co-hosting this event today, so welcome. So we're here today to talk about improving health outcomes for the more than 900 million people living with dermatological conditions around the world. 900 million. Our organization represents the patient organizations around the world. We're comprised of nearly 200 patient organizations in 63 countries, representing over 50 disease areas in dermatology. So we're here representing the patients. IAPO represents the patients across diseases, not just dermatology. And the ILDS represents the healthcare professionals that are working to support those patients around the world. I want to start by taking a moment just to tell you about my own journey as a patient advocate. So I've been working for GlobalSkin since 2016. But my journey as a patient advocate began in 2007, and that was when my son James was born. James came into the world with a port wine stained birthmark on his face, which covers about a third of his face. Because of this, I learned how to advocate for his health needs, and that includes treatments, comorbidities, and coordination of specialist care. I'm very fortunate. It's been quite a great experience. I live in Canada, but I know that that is not the reality for many patients around the world. Unfortunately, I have also learned through James's experience about what it's like to live with stigma and to feel shame and isolation because of having a visible skin condition. It's too frequent. It happens all the time to people who are living with these conditions. And it's very painful as a parent to see your child suffer. And there are children all around the world that are suffering from this, I'd say, in much more difficult circumstances than my child living in a high-income country. So I think as we go through this event today, we need to think about those people, and let's think about the vulnerable among the population, like children that are experiencing this. And it's hard to know that for him and many others that they will suffer this discrimination and poor treatment throughout their lives, because many of these conditions are lifelong. And as time goes on, I continue to see every day how these diseases are underestimated, they're underprioritized, and they're greatly misunderstood. This, even though there are more than 3,000 different dermatological conditions. 3,000. So it's not as though this is a small group of diseases. It's not a small group of patients, and yet there are huge gaps in care and understanding. And I'm sure that all of you in this room know at least one person who is suffering from one of these diseases. Something that all these diseases have in common that seems quite remarkable, and even though these diseases can be quite different in many ways, psoriasis, albinism, vitiligo, alopecia, scabies, or even a disease that is so rare that you have never heard of it, what happens is that these people who suffer from these diseases hide the fact that they're sick. And why is that? Why is it not acceptable for them to talk about the fact that they are sick? If you have cancer, you talk about it. If you have heart disease, you talk about it. Why is it with dermatological patients that they're hiding this, if they can? And it's not always easy to hide these diseases. Why is that? And I would say, from my own experiences, it's because these diseases are so minimized. And yet at the same time, they are so highly stigmatized. And it's as if to say, it's only a skin disease. But at the same time, people are saying, don't touch me, don't come near me, that disgusts me. So imagine being a patient that feels that their disease is not important enough to be talked about, and yet it has such an immense impact on their lives every day. So beyond the physical symptoms that they are enduring, they have a lot of psychological and social implications in their lives. And for many, as I said, it's a lifelong burden. And I will also say that in some cultures, there are huge social impacts. As I said, I'm fortunate that my son was born where he was. He's been able to manage relatively well in his life, but in some countries, the impacts are huge. People are shunned and they're not included. And there are also people who are in danger of violence. And that's one of the most extreme examples. And if you're not aware of the situation of people living with albinism in some countries in the world, please come and talk to any of us after, because that is one of the more extreme situations that has to change. So today, we've come here today in Geneva as a first step towards truly hearing patient voices and to begin the discussions about how we can meaningfully support them. We have a number of patient representatives here today in the room. I'm wondering if you could just raise your hands to indicate that you are a patient advocate. I encourage you to stay around after the event if you have time to speak with these patient advocates, because they have incredible experiences beyond just their own experiences as a patient. They have the experience of many patients behind them. And you're welcome to stay here at the beautiful John Knox Center and to have those conversations, walk around, and we may even have the executive director of IAPO lead a walk down to the lake if you're interested. In the meantime, we have some incredibly knowledgeable speakers here today, and that includes from the government of Tanzania and also the World Health Organization. We're so pleased that we have them with us today. And so without any delay, I will introduce our first speaker, and James Kilogwe, I hope I said that correctly. He's with the Ministry of Health in Tanzania, and he's going to bring us some initial greetings. James?
Good afternoon. My name is James Charles Kiologwe. I'm the Director for Non-Communicable Diseases at the Ministry of Health. May I bring special greetings from Her Excellence Umi Mwalimu, the Minister for Health, who is here actually in Geneva, attending the World Health Organization meeting, World Health Assembly meeting. Should have loved to be here, but due to other schedules at the World Health Assembly, she couldn't make it. And she told me to come here and convey special greetings from Tanzania. And one of the very important greetings goes to International League of Dermatology, which has supported so much Tanzania, including the Christian Kilimanjaro Christian Medical Center. That is a training institution that trains the dermatologists in Tanzania. And this is the center that has been established more than 30 years ago, and to date now has trained more than 400 health workers. And as we know that in developing countries, Tanzania being one of them. We have a lot of conditions for skin and skin diseases. And also with rare diseases, of course, we don't have the registers. We don't have the register for the rare diseases, which are manifest with the skin conditions, lupus being one of them, and others. We don't have the register, but the number of conditions with number of people with rare disease is increasing. But we are glad that we have the Association for Rare Diseases in Tanzania. I don't know how far I should go because this is a greeting, but I would like to share much from Tanzania. Where we have, in Tanzania, we have also quite a number of people with albinism. It's one of the countries with the highest number of albinism. Actually, in other places, the rate goes to 1 into almost 5,000 or 10,000. So it's such quite a number. And we're also grateful for the support that we have been receiving from International League of Dermatologists and other partners, especially getting the cream, that special that really it helps them, especially protecting the skin, and knowing that Tanzania is a tropical country, so exposure to lots of cancers, to skin cancers too, is such alarming. So just to say a few words now, I don't know if it's few, but I would like to share many, as much as I'm asked to do, is just to give you our sincere gratitude to be invited to participate here in this discussion. Thank you.
Thank you very much, James. We really appreciate you bringing greetings from your country, your delegation, and your minister. We've been fortunate as an organization to have had a board director from Tanzania. So we've been fortunate to have that perspective represented very importantly in our own organization at the leadership level. So thank you very much. So our next speaker is Anne-Marie Schlaumer. She's giving me the thumbs up because I have hopefully pronounced her name correctly. She is a patient advocate. She's with Lupus Europe, and she is from the Netherlands and is a person that is living with lupus herself. And she can explain to you the relevance of that disease with dermatology. So I will welcome Anne-Marie to the stage.
Hello all. You already heard my name is, I will pronounce it correctly, Anne-Marie Schlaumer. It's difficult for you all. And I'm really from the Netherlands. And I live with subacute cutaneous lupus erythematosus, in short SCLE, which is a type of lupus that only affects the skin. I'm a patient advocate with Lupus Europe, an umbrella organization that supports lupus patients organizations throughout Europe, at this moment currently 29. Lupus Europe aims to support and empower our national organization members, sharing information with them and promoting better patient-centered processes, both within the healthcare field and at the political level. And now I start with my journey. My journey to diagnosis with SLE started in 1997 when I was 31, usually the age when lupus is active in women and men, less men than women. and took 4 years until I was properly diagnosed. I saw many different doctors and specialists. I was prescribed many different treatments, including topical steroids, hydrochloroquine, I will call it Plaquenil here afterwards because this word really kills me, and prednisone, just to name a few. There are many drug cocktails that were tried until something worked. But my journey did not end after 4 years. Some of the treatments worked, and my lupus was under control for a while. But my challenges continued. In 2009, I had a flare of my SLE that would change my life. During a flare, my affected skin is very painful and burning feeling. My skin is itchy all over. My face gets swollen due to the lesions. It can cause the hair on my scalp to gradually thin out and also lose clumps of hair. I feel tired all the time. It feels like there is a weight constantly pushing down on a part on my entire body. I usually say it feels like being hit by a bus. This last flare, which was worse than the one I had when I was diagnosed, caused me to take a look at my life again. I had to stop working, had to stop running, had no social life anymore. I even got problems with my recurrent depression due to all I couldn't do anymore. When going to a swim in the swimming pool, people glared at me with disgust. Even the lifeguard commented whether I could swim with my skin condition, if I couldn't contaminate the other people in the pool. People on the street glare at me when I'm walking around on a very sunny day, covered in sun protective clothing, hat, shawl, long sleeve, long trousers. When being at the gym, not wearing long sleeves, being inside, doing medical business, people stared at me with disgust. Only one person came up to me, put her finger in one lesion and said, "What is this?" While working at the office, co-workers avoided contact with me, didn't talk with me, asked my employer if I could be at the office looking like this, and if it wasn't contagious. I told my employer that if my co-workers who have questions or want to know what is going on, they can come to me, not to him. When I was so sick that I had to stay at home, my employer turned against me. The stress caused a flare of lupus again. Finally, I was disqualified to work and have social benefit for the rest of my life. It took me a few years to get back to normal, accepting the new me, becoming myself again. I lost a lot of so-called friends. Turned out I have 3 real friends, and I've got a lot of friends in the field where I work now. I started to do more voluntary work, especially patient advocacy, which made me feel useful, appreciated again. Much research is going on for other types of lupus, and when going to the other specialists, like the dermatologist, you often get the response, "It's only your skin." For lupus, only a few drugs are available. It varies for each type of lupus and each lupus patient. For skin lupus, current treatments are, in my country, registered medicines, topical steroids, Plaquenil, prednisone, and off-label immunosuppressants and biologics. The off-label medicines are more expensive than the registered medicines. In the Netherlands, both these drugs are generally accessible for patients and are reimbursed through health insurance. Throughout Europe, this varies. Lupus patients had a huge problem getting Plaquenil during this pandemic because there was an announcement by a guy, I don't mention his name in this room, that declared that Plaquenil could cure COVID. Within lupus, much attention goes to SLE and lupus nephritis, not amongst others skin lupus. Having a skin disease is not nothing. It's our largest organ, which is ignored most. Having a skin disease often causes different comorbidities, like muscle pain, joint pain, fatigue, but also psychological, social, financial, and medical problems. This is one of the reasons why I started to get more involved in patient engagement, and when getting involved with Lupus Europe and their partners, such as GlobalSkin, I started to do more patient advocacy work to draw the attention to how having a skin condition affects patients, and getting attention for more research. I'm already a Eurodis alumni. I finished the summer and winter school, and this year I hopefully will become an EOPathy fellow in cohort 5. And now I would like to close my talk with one of my favorite quotes. I have lupus, but lupus doesn't have me. Thank you.
Thank you so much, Anne-Marie. You've shared a lot of very personal and difficult details with us, and I think it's so important for us to hear that patient perspective, no matter what part of the dermatology or health community we are in. Nothing can replace that patient experience. And I feel so grateful as the leader of GlobalSkin to have patient organizations like Anne-Marie's and patient advocates like her doing such important work to support patients around the world. It makes coming to work for me such a joy every day to know that there are people like her out there working so hard to change people's minds and to make life better for people living with dermatological conditions. So thank you, Anne-Marie. So next, it's my pleasure to introduce Professor Luca Borodori. He is chair of the Patient Organization Working Group of the ILDS. And the ILDS is a great partner of GlobalSkin's. And Luca is also the chair of the Department of Dermatology in the University Hospital of Bern. Luca is also an avid patient advocate himself. He's a dermatologist, but he truly gets the importance of hearing the patient voice and has been a strong advocate for our organization and the work that we're doing amongst dermatologists around the world. So it's a pleasure to have you here, Luca.
So, my ladies and gentlemen, dear friends, I'm very, very, very happy to be here today for the launch of the Global Dermatology Coalition. So I feel really privileged and I'm very happy to be on board. So I am a representative, so I'm member of the steering committee of the Global Dermatology Coalition, and today I'm also representative of the International League of Dermatological Society, and I would like to take this opportunity to highlight the burden of dermatological diseases, which is surely underestimated by most people. So I would like first to give you some insight about the International League of Dermatological Society, which has been so far the leading voice among the healthcare providers with regard to skin condition, skin management, skin health around the world. In the International League of Dermatological Society is the umbrella association, the umbrella organization. It encompasses almost 200 national societies all around the world, consisting so of more than 200,000 dermatologists all over the world and spread on our 6 continents. What is our vision? Our vision is to attain the best possible skin health for all people around the world. All people around the world. And the goal is to strengthen and improve access to skin health, to management, to essential medicine, essential medicine for skin diseases around the world through partnership, collaboration, and exchange. And we have 3 areas of our main activities. The first, we represent skin diseases, skin health, management for skin diseases, and we engage with the entire dermatological community to promote all initiatives aimed to improve the management of skin diseases locally and globally. Second, we make all our possible to foster, to strengthen dermatological care by supporting all kinds of educational activities which improve knowledge about skin diseases and management of skin disease around the world, which results then in better management. And finally, we want to be the strategic leader, so we want to be the leading voice when it's about to interact and collaborate with all stakeholders and policymakers to have skin health, skin diseases, dermatological disease on the political agenda with the aim that all possible measures and initiatives are taken in order to take care of people suffering from skin diseases. And the major activities, so the major areas in which we are active are the International Foundation of Dermatology, which is a wonderful organization which promotes a number of small-scale and large-scale projects to improve dermatological care all around the world, but particularly in low-resources countries, such as in Africa. Of course, we organize international meetings with attendees coming from all over the world. The next will be held in Singapore, but we also organize meetings where all stakeholders and policymakers are invited to discuss and think about skin diseases, epidemiology, prevalence, the burden of disease, in order to be a kind of think tank. What are the priorities on the agenda? What are the challenges to tackle first? And the International League of Dermatological Society has the privilege to work together with the World Health Organization. We are this society as representative of all dermatological societies around the world. We represent dermatology and we engage with the World Health Organization in order to have skin diseases, management of skin diseases on the agenda of the World Health Organization. And with regard to the collaboration with the World Health Organization, the strategic areas are, we have been working for now 15-20 years in making the final version of the classification of disease, which is very important in order to get a good overview of of all the dermatological diseases. Of course, there is the huge problem of neglected tropical diseases, as well as the access to essential drugs in many countries of the world, in which even the simplest treatment are hardly available or not available at all. We are also, we try with the World Health Organization to also to take all possible measures to avoid and to reduce professional diseases, so to promote occupational health. So skin diseases related to professions are one of the most common. So that's why it's very important to promote occupational health. We in the past years, we have also had an exchange and not a lot of initiatives with regard to the burden of chronic inflammatory skin diseases, which have been so far underestimated, like psoriasis, like atopic dermatitis, which are not simply diseases which affect the skin, but are really systemic disease with impact and negative consequence on various dimension, personal dimension, familial dimension, and social dimension. And finally, now with the population aging, of course, we want to promote skin health all around the world. And this is important for prevention of diseases and also to counteract the epidemic of skin tumors, which we observe not only in Europe, but all over the world. And so, of course, these initiatives have as ultimate goal, they want to increase the awareness with the policymakers about the importance of skin diseases and in order to improve really management of patients suffering from skin diseases all over the world. And here I would like to provide you some slides about the burden of dermatological disease. The numbers I found about incidence, prevalence, burden of disease are extremely variable because the data is incomplete and we don't have really comprehensive, well-done registries. And so that's why you will see that some numbers are different than those presented before by Geneva or later by the. So first, I would like to remember, and something that many colleagues and healthcare providers forget is that skin is not only the largest organ of the body, it's 3.54 kilograms, 2 square meters, but this is something very special compared to a heart or a kidney. But this is the first surface of contact between people. It starts right from the beginning. And so skin is really something important to transmit, to communicate with other people. Even non-verbal communication is critically important for social relationship and for the individual well-being. And so even big companies use the motto, because you love your skin, you love your body. So feel well in your skin. It's not only skin, it's everything. So, as Jennifer already highlighted, we have more than 3,000 different skin diseases which can occur at all during the entire course of our life, and which not only involve skins, but also hairs, nails, and the oral mucosa. And the mucosa, and we have a various group based on the mechanism, underlying mechanism. We have inflammatory, immune-mediated diseases, we have infectious diseases, and there are a lot of infectious diseases, malignant skin tumors, which are a real epidemic. So at least in Europe, one can consider that 1 out of 5 people will develop a malignant skin tumors during the life. And then we have, of course, also more rare diseases like congenital dermatosis. And here are some key figures. So skin diseases surely contribute to the global disease burden and affects millions of people. And there are at least 4 skin diseases which are among the top diseases affecting the world, like itch, like eczema, like acne, like fungal disease. Some people estimate that there are at least 1.8 billion people presenting now with some kind of skin disorders. According to our American colleagues, at least 30% of Americans have at least once a year a skin problem. And according to a recent survey of the European Academy of Dermatology, really making a survey all over Europe, it seems that up to 50% of the European population present some skin problems. And what are the consequences? Of course, the consequences are on personal level as a clinical complication. We have complications that lead to disability and also to mortality. But also the consequence is impact on the quality of life, impact on relationship, impact on your well-being, mental illness, which may result in depression and other problems. And then we have the consequence, more social and economic, which are very important. So a skin disease results in social isolation, in stigmatization. The person does not function also socially and economically very well because of skin disease, loss of productivity. As Anne-Marie said, she lost her job because of her disease. So these are not stories, these are what people do. It has a consequence at the level of the public health because skin diseases, they are frequent and they lead also to healthcare utilization and contribute to care cost. And then since skin diseases are frequent all over the world, it also poses a challenge in many countries where the resources are limited because we need absolutely essential care, basic management, access to essential drugs, and also the people all over the world have the right to be treated and to get a proper management. Here's some figures. Psoriasis, 60 million of people. Acne, the most frequent disease among skin condition. You see 700 million a person. Fungal infection, 1 million. Scabies, 130 million. Bacterial infection, eczema. So these are huge numbers. And I'm not an expert in epidemiology, but there is this global burden of disease initiatives which are supported by the Bill and Melinda Gates Foundation with several other institutions which regularly every year try to assess the death rate and the impact of diseases such as the disability adjusted life years, the daily, so the years of life lost due to premature death or lost because the patient is unable to function, to work. And here you see that all over the world, from low resources areas to more richer areas, these dailies are significant and probably underestimated. You see that there are chronic disease, chronic inflammatory disease, non-communicable, like psoriasis, like psoriasis and eczema, but there are also a lot of infective disease, scabies, fungal diseases, and viral diseases, and this is of course a problem particularly in low resources country. And I want here this recent data showing a little bit the trend about the number in death in dailies in the past 30 years. And I've highlighted here the non-communicable disease. And here you see the numbers concerning skin and subcutaneous diseases or neglected tropical disease. And you see that we are not here alone. We are here together with rheumatic disease, chronic respiratory disease, musculoskeletal disorders. And so it's not that we can neglect and say skin diseases are nothing compared to other diseases affecting other organs. And probably what yesterday an expert told me, Professor Luigi Naldi, he told me probably the scores which are now used by the official organizations are not at all appropriate in order to catch what is the burden of skin diseases, because they use standardized scores which are applicable to a variety of disorders. But please, how you can compare diabetes, hypertension, and thyroid disorders with skin diseases? So skin diseases, here you see some examples of skin diseases which really can completely change and put upside down your appearance, how you look, how you are perceived by the next person. How you can simply translate this kind of situation in dailies. So I think there is a huge, and this is the opinion of many leaders in dermatology, a huge underestimation of what means to suffer from skin diseases. And this is not only in high resource country, but also in low resource country. So, and please, so have a look of this disease of people who have to live with these disorders and meet another person during the. And of course, these people have also to be taken seriously by the healthcare provider. So we, as a healthcare provider, we have to really understand the patient's needs, the patient's perspective in order to be able to better treatment, in order to have a better exchange, in order also to have better trust from them towards us. So we really have and that's why I'm here. I think that I really have, I cannot do my work as a healthcare provider well if I not have a good relationship, a good understanding of what the patients want, expects, and needs as treatment, and also in the personal relationship. So finally, my final slide is, please remember that skin diseases are a huge problem in developing countries, in low resources countries. Most of the skin diseases are infectious diseases, fungal infection, bacterial infection, scabies. Unfortunately, the children are the people, the population group which is most affected and suffers of it. And you can imagine that in many countries, it's not so easy to access, to have the opportunity to meet a dermatologist. And people are already very, very happy if they can have the opportunity to deal with a healthcare provider with basic knowledge of dermatology skin diseases. And particularly in poor countries, in low resources countries, this skin disease has really devastating effect on the personal level, on family level, because these people are stigmatized, are marginalized in the village, in the society. They lose work, they don't earn anymore, and it's a real catastrophe. So that's why I'm here as representative of the ILDS, but as today as active member of the Global Dermatology Coalition. I think this is really a great day. The coalition represents really a milestone in the international patients advocacy movement, and a really very important moment. And I think the goal is really to increase the awareness of the global impact and high burden of skin disease, and patients are the key to make this to increase this awareness, and this association, this coalition, really will have as a main goal to prioritize to have skin diseases on the agenda of the policymakers. So thank you very much for your attention, and thank you for inviting me. Thank you.
Thank you so much, Luca. I think it was excellent to get this overview from a scientific and clinician perspective on the scope and scale and impact of these diseases. It's been very helpful, I think, to this event to get that context. Luca did mention a coalition, which we'll share more information with you about when we get just a little further into the program. For now, though, I'm going to introduce a video documentary that we've produced that we'll be showing you. And this is where you're going to hear directly from some more patients. We're really proud to share this 10-minute documentary with you. You're the first ones to see it. We will not be officially launching this until September, so you get a preview of it. And we've worked with patients in all of the 6 World Health Organization regions to provide their perspective on living with a dermatological condition. And you're going to hear from patients about the detrimental impact of their condition on their life and on their families. You're going to hear from Phoebe in Hong Kong, China, Martina in Slovenia, Arsene and his mother in Kenya, Natalia in the United States, Jamina in Colombia, and Reese from New Zealand. And as you watch this video, and the disease that you'll be hearing about is atopic eczema, eczema, whatever you call it, it is one of the most prevalent skin conditions in the world, but it's also one of the most under-recognized. And according to the WHO's Global Burden of Disease Initiative, more than 230 million people globally are affected by eczema, and this number is rising. Until recently, eczema has been mischaracterized as a Western disease, one that is only pervasive in countries with higher incomes and Western lifestyles. However, various studies that have been conducted over the last 10 to 20 years have shown that rates of atopic eczema are just as prevalent in low and medium income countries as high income countries. results have shown that this slow to shift bias against low and medium income countries has detrimental effects. Too many patients and caregivers do not have access to the basic services at the primary care level, and they must pay out of pocket for basic treatments that are prescribed by health professionals, which can be prohibitive for many people. So we're going to now share with you this very personal journey with these patients that they share with you through the video. So I'm now very pleased and honored to be introducing to you Guy Fonis. He is head of the Global Coordination Mechanism on NCDs, non-communicable diseases, at the World Health Organization, and he's going to present to us on the value of lived experience from intention to action. So I think we're just waiting for the slides, and I'll let you take the podium.
No problem. Thank you so much, Jennifer. Hello everybody. A pleasure and honor being with you today, and really humbling to come to the stage after that video, very powerful video. That's exactly what we need to hear. That's exactly what we want, and probably I don't have much more to say after that. So I'll try to land on how we transform that into policy, which is the last request in that video. My name is Guy Fonis, and I do lead a unit within the NCD program at WHO. In the NCD, Non-Communicable Disease Program, I lead a unit which is the Global Coordination Mechanism on NCDs, and it's quite relevant that I can present sort of the operating model, the operationalization of what we just heard here through our model as you launch this coalition. So I'll try to take you through sort of working together across stakeholders for sustainable solutions. NCD, in my case, it's really powerful to understand that most skin diseases are non-communicable and many are chronic. Not all, but most are. So we're looking at those sustainable solutions, and that the power of multi-stakeholder action, the power of working together across stakeholders is so important. Under that title, you have from global, regional, and country. That's a very important item that I put there, because I think we understand and we understood from the powerful message we heard in the video that we really don't understand what is the bottom-up approach, what is the context on the ground, how can we transform global dialogue, how can we draft and design and shape policies with the input from the ground, experiences, context, difficulties, challenges, opportunities on the ground. So that bottom-up approach that feeds up to the regional and global activities and initiatives is so important. And then I'll land on the critical element of multi-stakeholder action, collaborative action, is really exactly that, the value of lived experience. The hypothesis in my team is that lived experience is not really an experience, it's an expertise. And we take lived experience as an expertise in the same realm, in the balanced perception that we do also take evidence-based data from researchers and academic institutions. So really transforming that lived experience, that expertise into action. Thank you, that was the other way, sorry. There we go. Let's start with, how do we scope this? Why are we so committed, so passionate to develop this work stream? And we are way beyond the half point for the Sustainable Development Goal era. We're only 8 years away from that critical milestone. And the SDG era is really founded on a very strong principle and concept, which is to leave no one behind. If we really are to achieve, if we do achieve all 17 SDGs, we should, by default, leave no one behind. But as you heard before from many of the speakers already, and I'll underscore that, currently we're leaving billions behind. If we only consider the NCD agenda, we are leaving billions behind, and there's only 7 billion in the world population. So it's a dramatic data. So the WHO Director General launched a very important high-level commission that was convened for 2 years, the WHO Independent High-Level Commission on NCDs. And it had its final report, which was very nicely framed, it's titled, "It's Time to Walk the Talk." And one of the conclusions, or one of the assessments that the report provided is, why are we leaving so many behind? Why are we leaving billions behind from a policy-making position and from a community position? And they came up with those six challenges, which are so powerful, and I think they're all embedded in the messages we've heard today, and certainly come through in the video. There certainly is a lack of political will, of political commitment, political capacity in many countries and in national and subnational governments, and lack of, therefore, action. There's also a lack of policy and plans, comprehensive, sustainable, context-specific NCD plans, including for skin diseases. There's also a difficulty in priority setting across countries. Global priority setting has many times little to do with national and subnational priority setting, prevalence, and context-specific challenges. In the NCD area in particular, because of the unhealthy commodity areas, there's a very important fourth point, which is the impact of economic, commercial, and market factors, the commercial determinants of health, which certainly expands into broader social determinants. That's a very important process. We've heard some of that in your access issues. You've discussed access and availability, affordability. Well, this is a very important part of it. The sixth is insufficient domestic and international financing to support any local efforts. And also the lack of accountability of the stakeholders. We're all accountable, all of us. And it's interesting to see that you've convened, Jennifer, and partners, you've convened here a very interesting intersectional lens. You know, it really cuts across policymakers, organizations, NGOs, and lived experience. So, but we're all accountable for whatever happens here, not one more than the other. So we're sustaining that the solution here to this complex, multi-layered problem is collaboration, multi-stakeholder engagement, working with and across stakeholders. There's a clear need to leverage diverse stakeholders to address just those three, but maybe many more. You know, to increase the synergies and amplify the impact across these levels, and to really try to develop that bottom-up approach that really feeds the other way around, feeds country, subnational, right up to the global policy-making tables. Also, really to understand those context-specific challenges and opportunities. They're not all challenges. There are some great success stories happening on the ground that we need to amplify and disseminate. And then we really have to drive results founded on evidence, follow-up, and impact. And this is what we call the whole of government, whole of society approach. Whole of government, because we need to include all stakeholders in government, not only health, education, social protection, finance, commerce, et cetera, and then whole society, all partners involved in society. The GCM, I think I've lost the title up there, but the Global Coordination Mechanism, which I lead, has developed a very interesting model, an innovative model within WHO that brings all of this together, brings this multi-stakeholder convening, facilitation, and catalytic effort across stakeholders in a balanced approach. It's not a hierarchical situation. WHO and member states within WHO obviously lead and provide the strategic insights, but it is a very collaborative approach. And you see on the far right there are three pillars, which is WHO, the evidence-based, the norm and standard setting, which is informed by member states and different constituencies within member states. And that is our primary pillar for our focus on impact at countries. We don't want to do a talk shop at global level. We don't want to continue talking and discussing in dialogues and meetings and PowerPoint presentations. We want to get on the ground, see what's happening, and feed that right up the value chain to the policy development cycles. And that is supported by the GCM NCD participants you see at the bottom, which we have more than 450 participants already. I encourage some of you in the room, all of you in the room, to connect to the GCM and participate in an official status, participate in the platform. And we provide an inclusive, participatory, rights-based approach. You'll see our functions there. I won't go into that much more, but the middle of it is very important. Our ultimate goal is to strengthen national capacity, national leadership, national governance, multi-sectoral action, and partnerships to accelerate those national responses in an equitable, rights-based approach. I'll dig now into an example of how we do that. And it's a very relevant example because it's our very, very important work stream on what we call meaningful engagement of lived experience. Others have used other terminologies. There's participatory governance, there is community engagement, and also meaningful involvement. And there is an issue about meaningful engagement or meaningful involvement. More passive, more proactive, you can choose your word, but certainly our underlying foundation is that the co-design, co-development of policies, programs, and services is at the forefront of our work. on meaningful engagement of people living with NCDs, and you'll see MHC, which is mental health condition, which is always left behind, and it is a determinant and also a consequence of non-communicable diseases and chronic diseases, mental health. The status of mental health is so important. This is a long timeline. I use this just to maybe show off a bit and show you that we've been working on this for quite a long time. From 2016 on, we've been doing high-level meetings. We've been ensuring reports, draw attention. I mentioned the high-level commission. We've been behind that, ensuring there's a chapter on meaningful engagement of lived experience. And we go through, we've launched a WHO civil society working group that addresses recommendations to governments and to WHO on how to really ensure participatory inclusive policies and programs. We have membership of people with lived experience of disease and NCDs in that working group. We can certainly look at how to expand that further with those with experience and expertise of skin diseases. We've done global, regional, national consultations of only with lived experience, cutting across all the different intersections, communities, and connections and comorbidities. The interesting thing is that this long road of initiatives, actions, and interactions has called for the development, our community has called for the development of what we're calling a WHO framework for meaningful engagement of people living with NCDs and mental health conditions, the framework. We're in the stage of developing that. That will ultimately support not only WHO as an organization understand how to meaningfully engage lived experience in their policy development cycle, but also provide very clear recommendations, a toolkit, a mapping, capacity building, training for member states to do that on the ground, at home, not only national, but some national levels. That's what we're calling our framework. And this came about by what you see here. One of our biggest global conferences that we did at the end of 2020 came up with a report, was nothing for us without us. You've heard this phrase before. We didn't coin it, but it's so relevant, especially when you're talking about policymakers. Do not do any policy. And probably the gap that we understand is that many of these policies are leaving people behind because they're not relevant, not contextual, not acceptable, and not sustainable on the ground. So Nothing for Us Without Us report was a report written and developed by our partners with lived experience, and they had a long list of tasks back then, long list of requests. I'm happy to say that we're ticking the box on all of these. We've addressed all of them, which is we need to map case studies, we need to develop case studies, map best practices, we need to ensure we have more evidence on the ground of how the power of meaningful engagement. We need to look at alignment with other experiences, HIV, communicable disease, maternal child health, development areas such as climate change, etc. Aligning with those living those experiences also and lessons learned there. We need to look for funding options to ensure that sustainable mechanisms to engage lived experience are really sustainable, long-lasting, and are funded. Your time and expertise, it's not a given that it should be given free of charge in many cases. It's your time and your expertise again. And then advocacy pieces, we were doing the consultations. And the last point really is about that framework that I discussed, which we're working on now. But then another high-level mandate for us is not only the mandate given to us by a community of lived experience, but it's a mandate given to us by the SDG, the UN General Secretary General in New York, where in 2018 there was a very, very, very strong political declaration, which I'm happy to say we were very involved in ensuring that paragraph 42 was included and drafted. And it's a long paragraph, but at the end it says, forge multi-stakeholder partnerships and alliances that mobilize and share knowledge, assess progress, provide services, and amplify the voices of and raise awareness about people living with and affected by NCDs. So it's a call from member states that WHO, UN system, and partners have to commit to developing that. And we're going to the 4th high-level meeting on NCDs at the end of 2025. We have some time to go, but we have to make this a reality before then. When we go to New York in 2025, we have to showcase how we have done this, what sort of platforms, capacity building, and success stories we have. So here it is, the framework, which I was talking to you about. So we will be co-creating, we have been co-creating, that's a very important concept. We have been co-creating this framework from the very start, from the design, development, conceptualization, with our community, our partners with lived experience. And at the second half of the paragraph says, this will contribute to advancement of the understanding, knowledge, action on meaningful engagement, but very importantly, on the evolving evidence base. Many of member states, when WHO channels a bucket load of frameworks, guidance, documents, reports to member states and say, go, implement it. The first question is, well, what is the impact? Why should I do it? What will change in our health system? What is the health outcome? How will this framework change health outcomes? Our hypothesis, and we're developing through the evidence and through the framework, is that if you do not listen, understand, learn, and are guided by lived experience, you will not go beyond what you already have in the NCD agenda. That is why the NCD agenda is lagging behind. We need to have a game changer. We need to break the ceiling. And the only way to do that is really that bottom-up approach of developing contextual, sustainable solutions. So in the development, and we call on you to come on board with us, we're still building the evidence, we're still developing case studies, narratives, short films, story, advocacy pieces. We're doing literature review, systematic literature review. And while we build the evidence, we continue identifying more gaps on really bringing in inclusive representation across lived experience. We're missing out on a lot of experiences on the ground that really can unpackage the broad NCD agenda. NCD agenda is so complex. We're just talking today about skin, dermatological disease and skin disease. That in itself is a huge pool, but that is only one element of the NCD agenda broader. So it's so important to identify the gaps in the other areas, in your areas, for example. We're building networks. We've got huge networks at global, but we've got really interesting networks that we're building at regional, sub-region levels. And we're already building networks of lived experience, cross-sectional lived experience. We count on you to bring in your contextual networks, but we're building cross-sectional. We all can discuss together. We're all rebuilding those in national, sub-national level. And the last point here is what it's on this slide, building trust. So, when we're building policies, programs, services, and building the data, evidence base, and for health impact, where we're strengthening health systems, this is probably where we'll go to. This is probably where UN system, research institutes, academics will go to immediately, and they will probably rely mostly on this part of the scale. Looking at member states' experiences, policies, political players, political situations in countries, really relying on data, research, academics, broader UN agencies who are developing broader development agendas. We're looking more than not only on biomedical models, on quantitative data, and the traditional processes and procedures. I'm not saying this does not exist. In many cases it does, but it's hugely overbalanced to this side. So what we're doing with all this process is trying to balance the playing field, providing the trust for partners, policymakers, politicians, government officials, community members to really understand the power of lived experience, the power of lived experience as expertise in itself, and this is so important. It is data, it is evidence, and it should be used as such. We need to recognize the power, the expertise and the knowledge and the networks of civil society organizations, the advocacy, policy development expertise of civil society organizations. But we also need to understand and unpackage, look at those pockets of underserved populations, marginalized, vulnerable, and those areas of programmatic areas that are being left behind. And to build that qualitative data, which is so important. That video is such a powerful experience. That is qualitative data in itself. And then what we don't see here is what about the independent, your voices, lived experience, independent voices beyond just civil society organizations, UN agencies. So this is our work. This is the building the trust, building networks, building the evidence to really balance that much more equitable and inclusive. This is our process. I'm underscoring the evidence base behind it. We're doing peer reviewed. We're developing. We've got already 20 or so case studies, very powerful case studies. We've got the regional consultations. We have about 5 short films we're about to launch, animations. All of that is building into that WHO framework I call, which we will hope to launch at the end of the year. So we still have much more co-development, co-design we can do with you and your communities. And then once we launch it in 22, this is where the fun part starts, the implementation. We don't want a report sitting on a shelf. We want to take that report, transform it into derivative products, implementation products. Again, these are just examples. We have much more implementation toolkits, but very importantly, contextual. We want to translate that into contextual nuances, regions in countries, subnational, to different programmatic areas. We want to unpackage the NCD agenda and see how the framework works for dermatological diseases. And we need your work on that. That will happen in 2023 and beyond. And the key learnings, I'll leave that. I hope the slides will be shared. I don't want to take a bit more time. I don't go through all of these key learnings, but I've mentioned many of them now. I want to land on this last side, which is moving forward. How can we work together? So maybe this is what we can discuss in some of the panel discussions. How can we further align this topic to the work with being presented in today's session? How can we enhance that diversity of lived experience, that diversity of expertise that is so important to really ensure that that is a sustainable context and relevant tool that we want to provide? Are there additional opportunities where we can come in and support your efforts? How can we bring in our knowledge, our networks, and our network of policymakers to have that dialogue, to have that top-down, bottom-up interaction? And then how can we come together to consider implementation of this framework together with maybe the coalition you would launch? How can we leverage that? So these are just some questions to trigger some thought, and this is my email. Please be more than happy to connect with all of you. Thank you so much. Thank you.
Well, I was already fairly excited about this event. This is our first event at the World Health Assembly during, the week of all these incredible meetings and dialogue. But after hearing Guy's presentation, I think I feel all the more, because it feels like the time is right for us as patient advocates and as the larger dermatology community to work with the WHO. To me, it sounds like we are seen, and that they want to hear from us. And I think that would be a great discussion to have. And I know we're running over time, but I do hope that people will stay with us. We still have one more speaker, and then we will get into the discussion. I think there is much that could be initiated even today, just with some ideas on how we start this dialogue. And some of the words that stood out to me, Guy, that you used in your presentation, that I think are very similar to things that you'll hear from our next speaker, is around the multi-stakeholder approach, convening different voices and perspectives, not being a talk shop, being action-oriented. I think that that's absolutely what patients need, and that's what they deserve. And you use the word mobilization. I think that that's what our community is ready for. We are ready to mobilize. And I also was glad to see your mention of the quantitative data and to have more of an equal playing field. And I think that that is an issue in dermatology. We don't have the prevalence data. Luca pointed that out. That's a gap. I'm proud to say that our organization is working on a major research project, and we'll have data next year on the impact of dermatological diseases from the patient perspective using a new patient-led measure that we have created. So I think we can start working on leveling that playing field and filling those data gaps. With that, I'm very pleased to introduce our next speaker, who's my boss. Mark Yale. He is the board president of GlobalSkin, and he is he also works with the international the Pemphigus and Pemphigoid Foundation, which is a global organization serving those patients, and he is a patient himself living with pemphigus. And so he is going to elaborate a bit on this multi-stakeholder theme. And we are going to have a quick video first, and this is a colleague of Mark's. Sorry, let me just introduce our speaker here. So Noel Mudibu, he is a pemphigus and pemphigoid patient and advocate in Kenya. And Mark will give you a little bit more context about the work that he is doing with Noel in Kenya.
I'm a pemphigus and pemphigoid patient from Africa, and our organization in Africa is called Africa Pemphigus Africa, and so far we have 217 patients and caregivers. Our future plans are three. One is to help in the covering costs of treatment to our patients, because this treatment is very expensive and our healthcare system in Africa is not that stable, and majority of these patients are living below the poverty level. So some of these patients are dying because they cannot access treatment, timely treatment. So our future plan number one is to help these patients cover the cost of treatment. our next future plan is to create a broad-based data so that this data can be used for an Africa-focused research, and this research can help our patients access quality treatment. And then finally, our future plan is to help our patients access products, pharmaceutical products that are not in the market, so that their treatment can continue undisrupted. Thank you very much, and God bless you.
Thank you, Jennifer. So it's my pleasure to be here today speaking to this distinguished multinational group. Good afternoon. My name is Mark Yale, and I live with a rare dermatological disease called mucous membrane pemphigoid. Pemphigoid is a rare, serious, and potentially life-threatening autoimmune disorder characterized by painful blistering of the skin and mucous membranes. The blistering occurs because of an immune response that results in antibodies, autoantibodies attacking the proteins that bind the cells of the skin and mucous membranes together. Open sores left by blisters increase the risk of infection, which can be fatal if it spreads through the bloodstream. I'm a patient advocate for the International Pemphigus and Pemphigoid Foundation, as Jennifer mentioned, and I am the president of GlobalSkin's board of directors. I began my long journey with pemphigoid in 2007, and because I have a rare skin disease, medical professionals are really unaccustomed to seeing it in practice. As a result, people like me are often misdiagnosed with having more common illnesses that are seen more frequently by healthcare providers. Invasive and expensive laboratory studies are needed to distinguish my disease from other blistering diseases to achieve the correct diagnosis. Like many people that are diagnosed with rare skin diseases, I was not prepared for the challenges that came with my disease, like the stigma of being a person living with a rare skin disease, the loss of employment and accessing stable work, and the financial hardship and difficulty accessing appropriate health care. I was prescribed many therapies that were ineffective, expensive, and just made my quality of life worse with devastating side effects. I felt uncertainty and fear and anxiety for myself and for my family as I lost my eyesight and became partially blind due to the disease. I lost my career and professional life and wondered if I'd ever be a productive part of society again. After being hospitalized twice and undergoing these expensive treatments, the financial burden of the disease was immense. My doctors told my wife that she should get my affairs in order because they did not think I was going to make it. I wondered if I would ever have a chance to watch my daughters walk down the aisle when they got married or share the joy of being a grandparent with my wife. Now, today you've heard many different perspectives from our speakers, including my friend Noel from Kenya. Noel reached out to me and the IPPF because he hoped to create better access, more inclusion, and less discrimination for individuals and their families living with skin diseases in his country. As you heard, his goal is to improve the healthcare and outcomes of people living with these diseases, but he needs all of our support. You also heard about the prevalence of dermatological diseases and how these conditions are the fourth most frequent cause of human illness globally, affecting more than 900 million people in the world at any given time. Dermatologists diagnose and treat more than 3,000 different diseases, including atopic eczema, psoriasis, vitiligo, albinism, acne, alopecia, and thousands of rare skin diseases, including mine. These diseases cause substantial physical pain, disfigurement, and disability, and stigma, and lead to psychological, social, and financial burdens. They can be inflammatory, infectious, and malignant, and are among the most prevalent and disabling disorders, particularly in low-resource countries. You've heard about the hardship that patients face living with lifelong skin diseases with no cures, and how they feel and how they have to learn how to cope. You've heard about the diseases and how they have a profoundly negative influence on health and well-being of patients, their caregivers, and families all around the world. Because skin diseases can occur at any age and can last a lifetime. They can lead to sustained economic costs and can pose threats to the healthcare systems that we enjoy. However, despite the substantial scale of this health burden that these diseases attribute, unlike many other non-communicable diseases or neglected tropical diseases, do not receive the global policy or prioritization that they deserve. And we've also heard from the World Health Organization and the global coordination mechanism on the prevention and control of non-communicable diseases, which is focused on that multi-stakeholders engagement and cross-sectorial collaboration. As a patient advocate, it is really encouraging to me to hear about this proactive effort to identify the opportunities to engage people living with these NCDs. Nothing for us without us. The timing of this is truly wonderful because we are all here today to advocate for increased healthcare focus on dermatological diseases through that multi-stakeholder action that we talked about. In 2020 and in 2021, GlobalSkin brought together the global dermatological community through a series of multi-stakeholder roundtable discussions. The purpose of these sessions was to explore the shared challenges and objectives faced by dermatology patients and the communities that they serve. Patients were aligned in their perspectives that dermatological diseases are not well understood and that their impacts are seriously underestimated. And because of these misperceptions around dermatological diseases, patients around the globe are underserved and stigmatized. Research is underprioritized and underfunded, and access to specialist care is relatively poor. The roundtable participants unanimously agreed that collaborative action is needed to meaningfully address the difficult reality faced by skin disease patients. I therefore have the great honor today to share with you an important announcement. On behalf of 20 like-minded organizations, which include our event co-hosts, dermatology patient organizations, healthcare professionals, researchers, and industry, together we have formed a patient-led global dermatology coalition. We bring this news to you in Geneva during the 75th World Health Assembly, where world health leaders like you have gathered. We know that you are experts and influencers in your own countries and can support our work to change the perceptions about the often underserved outcomes of patients. Working together, this global dermatology coalition seeks to elevate the health policy prioritization of skin diseases, both at the global and country levels. Our focus is not to put medical dermatology on the global health agenda. Our focus is to put medical dermatology on the global health agenda and actively work to improve quality of life for patients like those that you heard from today. GlobalSkin is currently gathering verifiable quantitative data from patient perspectives on what it's really like to live with a dermatological condition. And I applaud the work that the GlobalSkin staff did on the video. I mean, I was really moved and taken back by the video. As a coalition, we will build an evidence-based awareness campaign, and we will advocate for greater policy focus globally, including here in Geneva and at the World Health Organization. But we need all of your help. Policymakers of the world, we need you. As you heard from the patients in the atopic eczema film, we need your help to ensure that treatments are affordable and accessible. We need dermatology to receive more attention in NCD and NTD dialogues. We recognize that the World Health Organization and the United Nations have outlined sustainable development goals, and country policymakers are working towards change with these in mind. We encourage decision makers to ensure that skin conditions are a consideration as you implement these policies. We see a direct correlation between these debilitating conditions and important SDGs like SDG 1, ending poverty in all of its forms everywhere, which really equates to access to affordable treatments and medicines that would contribute to this becoming a reality. SDG 3, to ensure healthy lives and promote well-being for all ages. As we've heard, dermatological conditions afflict people of all ages, even from birth. SDG 10, reduce inequality within and among countries. Access to care and treatments and medications for dermatological conditions in low-income countries is a challenge. And without those treatments, people suffer disproportionately. And lastly, SDG 13, take urgent action to combat climate change and its impacts. We know that UV exposure to our skin is on the rise and globally, and this will have a long-term implication on citizens and healthcare systems around the world. The Global Dermatology Coalition of 20 organizations and growing will actively work to improve patient outcomes globally. This would mean that we would have improved access to the diagnosis, care, treatments, and support that patients need, when they need it, no matter where they live in the world. Today is our first step, but it certainly will not be our last. We look forward to working with you to improve the lives of people living with skin conditions in all of your countries. And we invite you and other non-state actors with a focus on dermatology to join the coalition. No matter where they live in the world, skin patients deserve to live without shame and rejection, for their diseases not to be minimized, and to achieve a higher quality of life. Thank you for your interest and your time today, and I look forward to continuing this dialogue with all of you. Please stay afterwards, and I know we're going to move on to the panel discussion, so thank you.
So thank you. Ooh, I have to put this up. Thank you so much, Mark. And thanks for making that announcement on behalf of the co-host organizations here today, as well as the other 17 organizations involved with the coalition. That initiative is quite exciting, I think, for all of our organizations, because we will break some ground, I think, in dermatology by having stakeholders across different interests come together to work on common goals. And we heard, obviously, from the WHO today about that model being so successful. I personally know it's successful. In one of my previous jobs, I worked in the internet. And there is probably no example of a better multi-stakeholder model where everybody that has a stake has a voice and is able to help steer the direction of an initiative. And I think that it works well in healthcare, and it's going to work very well in dermatology, and it is going to help to level that playing field. So we are very excited. We have news releases that we can share with you. We are announcing this formally today. You were the first to hear it, but it has gone out to news media, and I think you'll hear a lot more from us in terms of our plans and also how we plan to advocate globally, and the WHO will certainly be a key part of that advocacy work. And it's so heartening to hear how there are mechanisms that will be in place for us to be able to have that collaboration. We are running quite late. Our WHO speaker has unfortunately had to depart for another key event, and I know that our representative from the Tanzanian Health Ministry also needs to depart. It's a busy day. So I think what I'm going to propose is, rather than having a formal panel, that we adjourn, and I hope that you will stay around, have a conversation with a patient advocate if you can, and feel free to take a look at our table. A couple of our patient advocates have to catch a flight, so there's a fewer things there than there were, but let's use this time to network with each other, and if you have questions of any of the speakers, please feel free to approach any of them. So I just want to close by saying that this applies to any of you, but obviously particularly policymakers, that when you return to your countries, when you return to your offices, when you return to your daily life, not when a health assembly is going on, that you ask questions and that you keep in mind the prevalence that is so high for skin conditions when you think about your citizens or the people that are within your purview. Ask how long they need to wait to see a dermatologist, and whether these patients have affordable access to medicines, and if not, what you can do to make a difference, and who else you can engage to help you. And we, on our side, promise to keep you up to date on the work of the coalition, and we will tell you how we can help you. So we will really be using today, I think, as the start of the dialogue, the very first step, and we look forward to taking this journey with you as we work to improve the health outcomes of people living with dermatological conditions. So thank you again for sharing your valuable time.